Welcome back to the deep dive. All this talk about game changers in global health. Well, get ready, because today we're diving deep into one that could be the biggest one yet, artificial intelligence.
It's a bit of a buzzword, isn't it? But
Yeah.
yeah, the potential is huge, especially in healthcare.
Okay, so for our listener who maybe hasn't gone full-on sci-fi nerd like us,
hmm
what exactly is AI doing in healthcare?
Well, think of it this way. It's giving computers the ability to think and learn just like we do, but like at warp speed. So AI can analyze massive amounts of data, right? Spot patterns we might miss.
Yeah.
And, make predictions about all sorts of things, from disease outbreaks to, individual patient risks.
So it's like having a superpowered brain, basically, helping doctors make diagnoses, develop treatments, and even predict who's most likely to get sick in the first place.
Exactly. And the applications are pretty much mind-boggling. We're talking AI analyzing medical images, like way more accurately than human radiologists could, predicting outbreaks of diseases like dengue fever weeks in advance, and even personalizing treatment plans based on a patient's data.
Okay, it sounds almost too good to be true. Are there any downsides we need to think about?
Well, yeah, there are always caveats with new technology, right? One major concern is that AI systems, you got to make sure they're trained on diverse and representative data. If not, they could just perpetuate existing biases and inequalities we already have in healthcare.
So garbage in, garbage out, as they say. It sounds like making sure AI benefits everyone is going to be a key challenge.
Absolutely. We have to be mindful of potential unintended consequences and work proactively to make sure AI is developed and deployed ethically and equitably.
All right, so we've got the big picture. Now let's get into the details. I know you brought a whole stack of research and reports on this. What are some of the most interesting findings you've come across?
Well, one thing that stood out to me was this study highlighting the potential of AI to kind of optimize healthcare delivery. In resource-limited settings, they used AI to optimize the schedules of community health workers in Brazil, and it allowed them to reach way more people in need.
So AI isn't just about fancy gadgets and algorithms. It's about actually using tech to make the systems we already have work better, to reach more people.
Exactly. And it's not just about efficiency either. There's more and more evidence that AI can improve the quality of care. For example, there are AI-powered portable ultrasound devices that are being used to diagnose things like pneumonia in children in remote villages where it's hard to get to a specialist.
That's incredible. It's like bringing the power of a high-tech hospital to some of the most underserved communities in the world.
And it's not just about diagnosis either. AI is being used to predict and manage chronic conditions too, like diabetes. AI algorithms can look at patient data and, provide personalized risk assessments, treatment plans, and even support medication adherence.
So it's like having a virtual health assistant for every patient. That could be a game changer for people who struggle to manage their health on their own.
And for healthcare systems that are stretched thin, AI can help optimize resources and free up clinicians so they can focus on the most complex cases.
This is all sounding incredibly promising. But I keep thinking back to the issue of trust. How do we ensure that people actually feel comfortable using these AI systems?
That's a really important point. It's one that researchers are working on right now. Transparency is key. If people don't understand how an AI system works, they're not going to trust it. That's where explainable AI comes in.
Okay, break that down for me. What exactly does explainable AI mean in practice?
Okay, so imagine an AI system that not only diagnoses a condition, but also explains how it got to that diagnosis. It might highlight specific features in a medical image that it looked at, or the data points in a patient's history that led it to a certain conclusion.
So it's like giving the AI a voice so it can explain its reasoning. This transparency could really help build trust among both patients and healthcare providers.
Exactly. It's about making AI a partner in care, not just a mysterious black box.
But even with transparency, there's still the potential for these AI systems to just repeat existing biases, right?
Yeah.
So how do we guard against that?
Well, one of the most important safeguards is making sure that the data used to train these algorithms is diverse and representative of the populations they're going to be used on.
So if you're developing an AI to diagnose skin cancer, the training data should include images from people of all skin tones.
Precisely. And it's not just about skin tone. We need to consider all kinds of diversity, age, gender, socioeconomic status, geographic location, and other factors that could affect health outcomes.
It sounds like a massive undertaking, but one that's absolutely crucial if we want AI to help everyone.
It's a challenge, but researchers and developers are increasingly aware of it. And there are promising approaches being explored, like using techniques to debias data sets and developing algorithms that are more robust to variations in data.
So it's about building fairness and equity into these AI systems from the ground up.
Exactly. And it's not just about the algorithms themselves. We also need to think about the environment where these systems are being used.
What do you mean by that?
Well, even the most amazing AI system won't be effective if the basic healthcare infrastructure is weak. For example, if people can't access basic healthcare services, or if there's not enough trained healthcare workers, then AI won't make a significant difference.
So it's not a silver bullet. It's about using AI strategically to address specific challenges within the system as a whole.
Exactly. AI can be a powerful tool for improving healthcare access and equity, but it's not a magic wand. It needs to be part of a comprehensive approach that addresses social, economic, and political factors that affect health outcomes.
This all makes a lot of sense, but it also raises a lot of questions. What are some of the key things our listeners should be thinking about as we move forward with this discussion?
One question to think about is how can we make sure that AI is used to close healthcare gaps, not make them worse? How can we guarantee that the benefits of this technology reach the people who need them most?
And what about regulation? How do we balance the need for innovation with the need to protect patients and the public from potential harms?
Those are all great questions that we'll be looking at more in the next part of our deep dive. So stay tuned. We've got a lot more to uncover in this fascinating world of AI and global health equity. The more we look into this, the more I realize AI and healthcare, it's not just about the technology.
Yeah. We talked about that before, how AI kind of needs a strong healthcare foundation to really work.
Yeah, it's like imagine having the most high-tech surgical robot, but no reliable electricity or trained staff. It's basically a very expensive paperweight.
True.
Mhm.
Okay, so infrastructure is key. But what about the people actually using these tools? Are we ready for that?
That's where things get interesting. There was a study I read about AI acceptance among doctors, and a lot of them see the potential, but there's hesitation too.
Makes sense. I mean, imagine you're a doctor, you spent years honing your skills, and now there's this algorithm saying it can do some of your job better.
Exactly. So integrating AI successfully, it's about trust, not just in the tech, but in how it's used.
More training for healthcare workers then, making sure they know how to interpret AI's recommendations and use them ethically.
Absolutely. But also we need to design AI systems that work with doctors, not replace them, augmenting their expertise.
It's that AI as a partner thing we talked about. And I guess that applies to patients too. They need to feel comfortable with AI being part of their care.
Yeah, for sure. There's a ton of research going on about how to present AI stuff to patients in a way that makes sense, like clear, understandable. So they actually trust the information.
Because a diagnosis from some black box algorithm, that's not reassuring at all, even if it's accurate.
No kidding. And this brings us back to those ethical questions. Data privacy is a big one. If AI is going to be looking at our medical records, how do we keep that information safe?
Yeah, that's important. And it's not just about keeping data secure, it's also using it the right way, avoiding bias, being transparent about how AI is making decisions.
Exactly. And that's where regulation comes in. We need some rules, guidelines and standards to make sure AI in healthcare is ethical. The World Health Organization, they're actually working on this.
So the whole global community is starting to look at these big questions. It's
Yeah,
good because it's too big for any one country to handle on its own.
right. AI development is happening everywhere, so we need to work together internationally to make sure everyone benefits, not just the countries with the most resources.
That makes me think about AI, maybe even democratizing healthcare.
Hmm.
Like, what if everyone, no matter where they live or their income, had access to the same level of, diagnostic accuracy or personalized
And
treatment?
that's the dream, right? But it's going to take more than just hoping for it. We need to fix that digital divide,
Yeah.
build up capacity in those under-resourced places, and design AI with them in mind from the start.
So it's not just about building the fanciest AI in Silicon Valley. It's about understanding what people need around the world and creating tools that actually work for them.
You got it. And that takes us back to the big question. How do we make sure AI in healthcare is helping everyone equally? Not making things worse.
Yeah.
It's a tough question, but we have to keep asking it.
And I bet the answer has a lot to do with who's actually making these AI systems. Are we getting enough different perspectives in the room?
That's a great point. And it's not just who's developing it, but who's benefiting. One of the things I read really emphasized involving the community from day one.
You mean bringing in the people who will be using these AI tools
Right.
in the design process?
Exactly. Getting their input on what the problems are, what worries they have, how they want to interact with the systems AI needs to be for the people, not just for the tech companies.
I love that.
Yeah.
But real talk, how do we pay for all of this? Making AI equitable. It's going to be expensive.
Well, it's a big investment. But think about the money it could save us in the long run. If AI can prevent diseases, help us treat people better, and reduce the need for those super expensive interventions, it could be a huge benefit.
It's like preventative care is cheaper,
Well,
but on a global scale.
you got it. And we're already seeing it happening. AI is being used to predict and manage outbreaks, saving lives and tons of money.
So it's not just about how much AI costs now. It's about the value it brings to healthcare overall, for everyone.
And the value goes beyond just money. AI could improve quality of life for so many people. Better healthcare, personalized treatments, and, overall well-being.
Okay, I'm convinced AI is amazing.
Mm.
But how do we make sure no one gets left behind in this revolution?
That's the big question, isn't it? And it's something we'll dig into in the last part of our deep dive. We'll be talking about some real ways to use AI to make global healthcare more equitable, taking into account everything we've talked about so far.
All right, so we've talked a lot about AI, the good, the bad, the tricky stuff. But now let's get practical. What can we actually do to make sure AI in healthcare is fair for everyone?
Yeah, the real nitty-gritty, right? Well, luckily, these sources, we've got some good ideas to start with.
Awesome. Hit me with it. Where do we begin?
Okay. Data. We talked about bias, but it's so important. The data that trains the AI, if that's messed up, the results are going to be messed up too. So step one, make those data sets as diverse as possible. Really represent everyone.
So like if we're talking about AI that diagnoses heart disease, we need data from all ages, backgrounds, genders, ethnicities, everything.
Exactly.
Yeah.
And it's not just demographics either. It's things like socioeconomic factors, access to healthcare, where you even live. All that can affect your health. So AI needs to understand that.
Gotcha. Data diversity is key. But let's say we nail that. What's next?
Okay, think about it this way. You can have the best data in the world perfectly balanced, but if people don't trust the AI, it's worthless.
Right, trust. We talked about that with doctors and patients.
Yeah. So training is huge. Healthcare professionals need to learn how to use these AI tools, how to understand what they're saying, spot any problems.
So doctors become partners with AI, not just following blindly.
Exactly. And with patients, it's all about communication. Explain how AI is being used. Make sure they understand everything. Give them a choice if they're not comfortable.
That's important, giving people control, especially with something as personal as health.
Absolutely. And this all leads to regulation. We need rules to make sure AI is developed responsibly. Patient safety and privacy, that's got to be top priority.
But how do we make sure we're protecting people and not stopping innovation? That seems tricky.
It is, but not impossible. A lot of experts are saying we need a system based on risk. So the more powerful the AI, the more checks and balances.
Makes sense, like how we regulate medicine.
Yeah.
More testing if it could have a big impact.
Exactly. And this is where global teamwork is so important. AI is everywhere, so we need international standards to make sure things are ethical and safe, no matter where the tech comes from.
Because if some rogue AI is out there diagnosing people in one country, that could affect everyone, right?
For sure. So organizations like the World Health Organization, they need to step up, bring experts together from all over the world, figure out these ethical and regulatory systems.
Okay, so we've got the data, the training, the rules, anything else we need to make AI equitable.
One thing people forget: funding. We can talk about ethics all day long, but if there's no money to actually build these solutions, especially in poorer countries, it's just talk.
Right, AI that helps everyone, not just the rich countries.
Exactly. So we need everyone on board. Governments funding research, the private sector investing, and philanthropists supporting the projects that might not make money but can really help people.
It's like a global effort to make AI fair for everyone.
I like that. And it shows this isn't just about tech. It's about realizing that everyone deserves the benefits of AI, no matter who they are or where they're from.
Now, it's a tech challenge, an ethical challenge, a funding challenge, and in the end, it's a human challenge.
You said it. And that's what makes all this so interesting. AI could change healthcare as we know it, but only if we're careful.
Work together and keep that goal in mind, making sure everyone have access to healthcare.
Couldn't agree more. This deep dive has been incredible, and I hope it's gotten our listeners thinking. This isn't just about the future of healthcare. It's about the future of humanity and how we use these powerful tools we've got.
Yeah. If there's one thing to take away from this, it's that we have a choice. We can shape the future. AI can be a force for good, but it's going to take all of us working together, asking the hard questions, holding each other accountable, and never forgetting that goal. A world where healthcare is truly equitable for every single person.
And on that note, we're wrapping up this episode of The Deep Dive. But the conversation doesn't end here. Keep learning, keep asking questions, and keep pushing for that future where AI helps us all. Thanks for listening.